The idea here, though, is that mind-altered state is something which is necessary to achieve orgasm. Some people probably have just the good fortune that their mind can allow them to get there on their own, and other people, like, do not necessarily get to that state, at least consistently, without maybe the assistance of something like cannabis.
Well, I call it cannabis-assisted orgasm. And that women need to be in an absorbed state of consciousness. They need to be focused on their body and focused, or I'm not going to say focused on their body necessarily. They can be focused into a fantasy. They can be present to just the sensation. But the key is to not be in the executive function of the brain that is doing the evaluation.
We are here on the Erectile Dysfunction Radio podcast with another episode. Today we are joined by Dr. Suzanne Mulvehill. Dr. Mulvehill is a clinical sexologist, an orgasmologist, and director of the Female Orgasm Research Institute. She joins us today to discuss sexual dysfunction and its treatment through and with cannabis. So I want to emphasize to our listeners that Dr. Mulvehill's work focuses on female orgasm. In particular, we are going to try to do two things in today's episode. One, understand challenges with female orgasm and the role of cannabis in trying to overcome some of those challenges. And number two, discuss the crossovers to male sexual dysfunction. And I want to emphasize that many men out there who have female sexual partners are very worried, preoccupied, concerned with their partner's experience. When a partner is struggling to achieve orgasm or is not experiencing pleasure in the bedroom, this anxiety can spill over and cause performance anxiety, cause erection issues, ejaculatory issues, and whatnot. So this is a topic that I think is really important that we cover, both from the female but also from the crossover to male sexual function perspective. So all that being said, Dr. Mulvehill, thank you very much for joining us today.
Thank you so much. Mark, I don't know if Mark Goldberg. I don't know if you want me to call you Mark or how you'd like me to.
Mark is great.
Mark. Okay. Thank you so much, Mark. Thank you for inviting me.
Yes. So, Dr. Mulvehill, to get us started, can you introduce yourself? Tell us a little bit more about your background, your expertise in the field of sexual health and cannabis.
Sure, absolutely. So I'm going to just start out by sharing with you that I had this female orgasm difficulty / disorder for more than 30 years. And I saw 4 sex therapists to try to help me overcome it, to no avail. And when I used cannabis in 2017 I tried it once in college. And I'm going to give you my personal and my professional, and you can take what you like from that. Anyway, the point I want to make is I ended up, when it actually helped me unblock myself to experience orgasm, I sold my company. I went back to school to get my PhD and study cannabis as a treatment for female orgasm. So up to 41% of women experience orgasm difficulty. And this is a worldwide issue that has not changed statistically in 50 years. Furthermore, there are a paucity of treatments and there are no conventional medications. In fact, there's only one treatment that was recognized by Hyman and Meston in 1997 when she did an analysis of not just female orgasm difficulty, but all sexual dysfunctions for men and women, and found that there's only one validated treatment, and that's only for women who've never had an orgasm. And that was developed by Lo Piccolo in 1972. It's called directed masturbation. There is no validated treatment for situational female orgasm difficulty disorder, which is basically partnered sex, when women can orgasm perhaps from masturbation and self-pleasure, but they can't bring it into the bedroom with their partner. There's no validated treatment for that. Cannabis has been found to be statistically significant in helping women orgasm, as well as improving orgasm frequency, ease, and satisfaction. And there's research going back for 50 years.
Okay, so we're going to definitely dive into more of that. But just to clarify for our listeners, directed masturbation, is that a behavioral intervention?
So directed masturbation, it's like a 9-step approach, and it teaches the woman first to become familiar with her genitals. And it's a step-by-step program that integrates eventually the partner into the practice, where the woman would masturbate in front of her partner or with her partner, basically, and teach him. She's got to first learn what works for her if she's never orgasmed. And I think to preempt this entire conversation with conversation in the bedroom, for couples to talk about what is and what isn't working and not fake and pretend. I mean, it's men can pick up on that too. I've spoken with men who have said, I had a feeling that she might have not really orgasmed, but it's even setting a container, which is a different topic than this.
Dr. Mulvehill, just to kind of get into a little bit more of the work that you do. So obviously orgasm is, one of the centerpieces that your work focuses on. Are there other, sexual function issues that your research, or just generally the research around cannabis, focuses on?
Okay. Well, currently, I'm going to first start by saying that there are 5 domains of sexual functioning for females. And the Female Sexual Function Index is something that measures that. So it's desire, arousal, orgasm, pain, and lubrication. So those 5 have been measured by Kasman, for example. There's a study by Kasman, and I'm happy to give you copies of these if your listeners want to read them. This was a study that evaluated using this FSFI, Female Sexual Function Index, evaluating the 5 domains of sexual functioning. Dr. Becky Lynn also evaluated the 5 domains of sexual functioning, these same 5, and both found that orgasm was enhanced, sexual pleasure was enhanced, sexual satisfaction was enhanced. In my study, I just finished my dissertation for my PhD last year. And in my study,
Congratulations.
thank you. Yeah, it was an accomplishment. Evaluated 1,000, had over 1,037 women that completed the survey that used cannabis within the last 30 days. And they also had to have had partnered sex within the last 30 days. We specifically evaluated partnered sex in women with orgasm difficulty because a lot of women can orgasm to masturbation, but not. So I wanted it to be very clean in that regard. And the bottom line was that if women were able to orgasm, the majority of them had no other sexual issues. The number one sexual issue for a woman who and it was dichotomized by women who had orgasm difficulty and women who didn't. So women who had orgasm difficulty, the number one sexual complaint was pain during sex. And for women who did not have orgasm difficulty, the number one sexual complaint was lack of desire. So I don't know if that kind of answers your question about how they're in common and how they're measured or what's measured in studies.
No, that definitely helps to give us like a better sense. Now, Dr. Mulvehill, in your view, because I know that you are a sexologist, obviously a lot more focus on female sexual function, but how do you understand or look at male and female sexual dysfunction? Do you see them as being more or less similar to one another?
Well, I think they're similar to one another, very much so in the fact that they're not talked about and they're shamed. So, and I think for men, it's even more difficult, in my opinion, even though there's plenty of studies that have gone on for men. I mean, by far. I mean, if you look at the I did post on LinkedIn a few months back about the number of studies on male orgasm difficulty and female orgasm difficulty, and being that the DSM changed male orgasm difficulty to delayed ejaculation. They used to line up, in the DSM, where it was inhibited male orgasm, inhibited female orgasm, male orgasmic disorder, female orgasmic disorder, where men have now, who have orgasm difficulty, don't really have a proper, in my opinion, a proper term. Delayed ejaculation is not an orgasm, does not represent that's an orgasm problem, in my opinion. So I think they're very similar in terms of affecting both affecting both partners, meaning a woman is when they're in a partner, and we're going to talk about a heterosexual relationship in this example. Woman's orgasm difficulty or lack of desire or pain, vaginismus, for example, affects her partner, and equally so, males who have sexual dysfunction, it affects the female. So the answer to your question is they're similar.
Yes. Okay, and that's really helpful. Maybe I'll just kind of take like a side note here just for a moment. So I think there's definitely been an evolution in the DSM over its different versions. And I think what went from being a very psychologically driven approach, like kind of following Masters and Johnson, which is how this ended up in the DSM in the first place, has over the years, I think, shifted to a little bit more of a medical model, which might explain that shift in terminology. But I think also kind of gets to the heart of the matter, like we're going to try to understand today, which is like when we're talking about the impact of cannabis, like are we talking about this on a psychoactive level, or are we talking about this, let's say, on a peripheral nervous system level, that it is having effects on areas of the body that are not necessarily in the mind? In other words, like, are there physiological realities to the use of cannabis, like as opposed to the psychoactive effects? And I think that's split, if
So,
that is the
okay.
yeah.
I think the word psychoactive has gotten a bad rap in terms of what it actually, I try not to use the word psychoactive. I prefer to use the word altered state of consciousness in it creating an altered state. So, in terms of it affecting, being used to relax, I was just submitting a petition and noting that using it to relax obviously it relaxes the parasympathetic nervous system. What it does with the mind. So, if we take a woman who has a sexual abuse history, for example, which 1 in 8, I think, it's about 20%, maybe it's 1 out of 6. Woman has either childhood sexual abuse or a sexual abuse history. And that trauma gets stored in the amygdala, the part of the brain that stores trauma. THC is known to reduce the activity in the amygdala, in this part of the brain that stores trauma, which is part of the reason why PTSD has been approved as a condition of treatment in at least 30 states. Because the trauma is stored in that part of the brain. So I think there's effects on, not that I think, it's been scientifically proven that there are effects also on the prefrontal cortex, like the executive functioning of the brain, where cognitive distraction is one of the number one issues that women have in not being able to orgasm, feeling that they're taking too long, wondering if their partners are still feeling like participating, just wondering if the child's going to wake up, being cognitively distracted. And cannabis allows for dishabituation, the THC, to dishabituate the habits and focus more on the body. We can get into some of that. So I think it's both mind and body. It has effects on both. And too much cannabis actually it's kind of like the Goldilocks, finding the right bed, it's
Yeah,
finding the
yeah,
right amount, the
the
proper
right
dose.
dosage. Yeah, I'm gonna ask about that a little bit later because I was
Okay, we
curious
can go
about
into
that
that
as well.
later.
But the idea here, and this is really what I'm trying to get at, where I
Okay.
see again potential crossover for male sexual function again, is a lot of the medical model currently looks at things really from the neck down. And there are different systems then between men and women, very very different systems. Okay, but from the neck up, like, there's a lot of crossover. Experiences are different. There certainly are differences between men and women in this regard. However, the idea of habituation and distractibility and anxiety and whatnot, those are more universal experiences. So if cannabis is playing a role up there, some of it potentially that is we're seeing to be effective with women could have crossover to men.
That's correct.
That's really what I'm trying to clarify. And I'm hearing you say that that should be the case, meaning that there is a mind altering element to this that could change the state of thought or the state of mind, leading to a different sexual outcome for women, at least.
Actually, that's correct. And if you look at the recent definitions on orgasm that were approved, like I think there was finally some agreement about what orgasm actually is for men and for women. Women, it talked about the orgasm being an altered state of consciousness, which there's research by Sayin. His name is Sayin, where he talks about cannabis creating an altered state of consciousness. So if you start putting those two together, otherwise we're in the executive functioning. Am I going to orgasm? The spectator, as Masters and Johnson would call it. Am I going to orgasm? When I interviewed women for my research, they would talk about that.
Okay. So, I mean, I think what you're sharing is also really, really key, which is to achieve orgasm, generally speaking, one needs to be in some mind-altered state as defined by not in that active spectator
That's correct.
analyzing type of
It's been
role.
called by, some of the researchers back there was a lot of research on female orgasm, like back in the 70s and 80s, because back at that time, the DSM actually said that women who could not orgasm from penetration alone they were having it was a psychological problem. It was actually listed in the DSM. So they tried to help women have orgasm from penetration only. This goes back to Freud thinking that, it can take us back to
An immature orgasm,
an
I think, was
immature
the
orgasm with the clitoris, and it turns out that the clitoris is really all we have, as women. And it was just found in the 90s. Beyond just what you can see on the outside is what is actually inside the woman's body. So I lost track of what I was going to answer for you. I apologize.
right. I think, but the idea here, though, is that that mind-altered state is something which is necessary to achieve orgasm. Some people probably have just the good fortune that their mind can allow them to get there on their own, and other people, like, do not necessarily get to that state, at least consistently, without maybe the assistance of something like cannabis
Well, I
that
call
can
it
help.
cannabis assisted orgasm. And
Okay.
that women need to be in an absorbed state of consciousness. They need to be focused on their body and focused. Or I'm not going to say focused on their body necessarily. They can be focused into a fantasy. They can be present to just the sensation. But the key is to not be in the executive function of the brain that is doing the evaluation and
Mhm.
and checking on what's going on.
Okay, so to that end, I'm going to make an assumption that the THC is the preferred component here as compared to the CBD. Is that
I would say that's
correct?
correct. In
Okay.
the women that I interviewed and in the studies that I have analyzed and reviewed, it is the most of the people that I have interviewed and that I have seen in studies are either smoking flower, but yes, it is the active chemical is the THC.
In the research or in interviews or whatnot, is there any direct influence that we are aware of cannabis on libido and arousal? I know you mentioned that there seems to be this general trend that as orgasm improves or people who are more orgasmic, they tend to see more of a lift in all these other areas. Is there any direct effect? Like, do we have
There's
any studies on?
Yes, I mean
Yeah.
there are studies that show that people are having more sex in the states that have medical marijuana that have cannabis approved. So yes, it does have an effect on arousal, desire, orgasm. Ashley Manta, who has a company called Canisexual, talked about having vaginismus and how she developed a whole business model around cannabis for enhancing sexual pleasure. So yes, it has an effect on desire to have sex as well.
Moving toward the actual cannabis use, are there any risks or side effects associated with using cannabis for sexual health?
I think the first thing to say about that is that I would suggest that they are reviewed by their doctor. I mean, there are always risks and adverse effects in any medication. So if we look at this as a medication, there are risks. I mean, there can be risks of if there's histories of psychotic behavior, for example. There are risks along those lines of it. Could be triggering a psychotic episode. I don't think someone would have to be evaluated by a doctor to that's my recommendation is to first see a
In
doctor.
other words, this is it's important to emphasize this. I mean, I'm in Maryland. It's a state where marijuana is legal recreationally.
Okay.
Um, and there's a number of states that are like this. So it's important just for listeners who might be in those states to understand that there's a difference between being medically evaluated for a medical marijuana license or that type of process versus going to the dispensary on one's own and self-dosing and using recreational marijuana. So I think what you're emphasizing is for these purposes, like it's important to have an evaluation. This is not meant to
Absolutely.
be
And I mean,
something.
Maryland,
Yes.
I just submitted the petition to add female orgasm difficulty disorder as a condition of treatment for medical cannabis in Maryland. I mean, Connecticut just approved it last week. So it is a medical, the way I like to look at it is it's a medical condition that deserves medical treatment. So when that's it. And knowing how to dose properly, seeing a doctor who is using medical cannabis with their patients. And yeah, because trying it out on their own, I mean, it's as one woman I interviewed said, it's not a magic pill. So it needs to be used with a lot of consciousness and intention and setting, creating an environment where it's safe to surrender.
Are there any situations that the research has uncovered or that you've encountered in your work that cannabis would be counterindicated, like for treating orgasm? And I want to be clear, there are a number of conditions that people have or genetic predispositions that people have where cannabis itself is not indicated. Like you mentioned, predisposed to psychosis, it's, strongly encouraged to not be using marijuana. I'm talking about specifically like if somebody has experienced X, Y, and Z in their life, or they have particular genetic markers that cannabis would actually be ineffective or potentially unhelpful in the treatment of the orgasm
I
issue.
haven't seen that yet in the research. I have seen that they're more susceptible to developing cannabis use disorder because of their makeup. Also, that women are also more likely to experience the sexual benefits. That was out of a study in 2010. I have, from my own interviewing of women for my research, for example, a woman who was meeting with someone on Tinder and then they were getting high together and she found that wasn't working for her to solve this orgasm problem. And she realized that, she really needs to have a meeting with this person first and get to know the person, So, I mean, that just sounds like something that would be maybe we would know to make those, to have those precautions. But for some people, it's their own trial and error.
Yeah.
There was a woman who she had never masturbated. She doesn't masturbate. She has a history of sexual abuse. So it's a little off the spot of what you were just directly saying about, are there any genetic markers? I'm not aware of that. I don't think the research has evolved to that point yet. Only 4% of the women in my study who used cannabis before sex had an orgasm. So on average, it's 10 to 15% of women have
Okay, so
anorgasmia.
that's a significant discrepancy. Okay, now, Dr. Mulvehill, if somebody uses cannabis in over the long haul, meaning they discover that they have this orgasm challenge and whatnot, and they find cannabis to be an effective intervention for them. So, twofold question: one, does a person's mind become altered or changed, or do they learn how to enter this state on their own without use of cannabis over the long haul? And number two, if not, and I'm sure like for many people that is not the case, is long-term use of cannabis safe?
Okay, so let me answer the first part. This goes back to 1970. Barbara Lewis wrote a book called The Sexual Power of Marijuana, with an entire chapter dedicated to marijuana and frigidity, because frigidity was the term that was used back then when a woman couldn't orgasm. And she mentioned that 4 women had told her that they learned to orgasm using cannabis. And then once they knew how to orgasm, they didn't need it anymore. So that leads to what I was sharing about, which is the neuroplasticity theory, meaning the theory states through science that once a new neural pathway is developed, and just to taking this example of these 4 women, for example. Now, I will share with you that in my research, I'm going to just share women a little bit about the 2 groups of women, the women who did have orgasm difficulty and the women who didn't. And then I'll get to the long-term issue that you mentioned. Women who did not have orgasm difficulties, and they were answering questions about How often do they orgasm with cannabis? How often do they orgasm without cannabis? They orgasm with or without it. They have an increased frequency. They might have gone from I orgasm most of the time without cannabis and I orgasm all the time with it. But the majority of women who had orgasm difficulty, there were 202 of them in my study, 52%, almost never orgasm without cannabis and almost always orgasm with it during partnered sex. I don't have the actual research I haven't done like a longitudinal study of cannabis users who have orgasm difficulty and are using cannabis. I'm sure there's research out there, and it depends on how often someone's using it. If someone's using it and why they're using it. If someone's using it 24/7 to cover up problems in their lives, meaning not to feel them, to feel good instead of to feel the problem, whether it was childhood sexual abuse, whether it's alcohol addiction, whatever it is, it can be used in my life experience, it can be used in two different ways. It can be used to enhance one's life and to get to know oneself better, and it can be used to cope with life. So that is, I don't know if studies have looked at long-term use based on those two
parameters.
Dimensions. But clearly, youth under the age of 25 with an undeveloped brain, I think the studies have been pretty clear that it is damaging to youth who are using it heavily, especially in, I know some people who have been affected by long-term, by heavy use at an early age later in life.
Okay, and again, I think it goes back to, like, it's really important to consult with a doctor, and that's why even as states push to legalize recreational access, which means that really anybody can just walk in as long as they are, of the correct age. It's really important to consult with a doctor if you're doing this for medical reasons, and kind of working out your dosage and working out use and frequency and whatnot. I think that consult really goes a very long way. All that being said, is there a preferred method of consumption? Marijuana comes, or cannabis comes in like a slew of different deliverables, and you can eat it, you can smoke it, all kinds of ways. You can drip it. So is there a preferred method that's been studied for achieving this, again, mind-altering state?
So the studies, just to clarify, the studies that have been done are observational, meaning there has not been a randomized controlled study for cannabis as a treatment for female orgasm. I can say that most people in the studies are either smoking the cannabis, followed by vaping would be second. The eating of the cannabis, I would say that requires more of a knowledge of how long. Like, I had one woman I interviewed that says that she made her own brownie. She said, I eat a quarter of a brownie. So knowing how much to use and which type to use is really something that comes through. Yeah. Mind you, there hasn't been this. Women have been learning it on their own. So in a sense, I heard it as called bro science, meaning it's science that has come through the people because there hasn't been any.
You think it has not been a controlled study, and also kind of pointing out that each person's body is going to metabolize these substances differently.
That's absolutely correct.
So for her, it was a quarter of a brownie and an hour and a half before. For somebody else, it may be 3 hours. For somebody else,
that's
it may be
correct.
25 minutes.
And some would share a joint with their partner, and others would take one hit, and that was enough. So the point was that these women that I interviewed knew how much worked. They had gotten past the point of, one woman took a whole year to, she had lost her ability to, or she was a woman I interviewed. She had 3 surgeries that changed the shape of her vagina, and sex became painful with her partner. She lost the ability to orgasm for 2.5 years, and it took her a year of trial and error she began to find sensation to come back. Another woman had neuropathy, a similar situation with having lost sensation and having it return, and it taking time.
Okay, so Dr. Mulvehill, kind of bring this all full circle here. So what do we know about cannabis and male sexual dysfunction, whether that's erections or ejaculatory disorders? Are these things being studied? And if so, do you happen to know or have access to some of that research?
Absolutely. Um, I would say they're not studied as, like, I can think of three studies off the top of my head directly for women since 2020. There was a study done by Amanda Moser in 2023. It was 811 men and women that found that there was 61% of that study that was female. However, cannabis was found as helping men and women. And studies going back, Eric Good in the 70s, this study I mentioned by Barbara Lewis studied men and women. So they had been, men had been benefiting from it, women have been benefiting from it. There's also studies that show men get erectile dysfunction from using cannabis. So again, it's not an exact how much to use. Maybe it's not going to work for everyone, just like anything else.
Right. And I mean, as you probably are fully aware, but it's important for our listeners to hear, people's experience with marijuana is not ubiquitous. Like some people react very negatively to it, and their minds do very different things than other people's. So there probably is some variation from person to person as to whether this will be an effective type of intervention or help to facilitate the type of mind altering experience that one wants to have.
There's a
Um,
book that was written in the 1950s. Becker is his last name. It was called How to Become a Marijuana Smoker. And it basically talked about if people could not learn how to enjoy the benefits of it, they weren't going to keep using it. If they didn't find it as pleasurable. I mean, I can tell you as someone who used it as a college student in 1980s, in the 80s, I took it, there were a group of kids smoking cannabis outside in the parking lot. They said, "You want to have a hit?" I said, "Sure." This was before physics class, so I go and take a hit of cannabis, and it was the first time I got high. I had an anxiety attack. I mean, I don't remember what happened. I just remember feeling awful. And I'm like, that is not the place. I am not a social kind of marijuana. I don't, having been someone who struggled with anxiety attacks, feeling in an altered state in a social environment or in a party is not a good feeling for me.
right.
It's knowing and learning. I had to teach
How to
myself
use it,
how to
right? How
use
to
it.
use it, how to use it properly,
That's
right?
correct. I mean, and how to use it in the right setting, in the right mindset. All those things are critical because it
Hmm.
is about surrendering into an altered state. And so we have to be in a feeling of safety in
Yeah.
order to do that.
Yes, that's really, really, really important to hear because again, and I don't know, what state you're in. Where are you
Florida.
located? Florida. Okay, so I don't know what their current stance is on recreational, but I know that here in Maryland, the use of marijuana has obviously gone up tremendously, and a lot of people are using, experimenting, recreational, etc., because the access is
Wow.
so easy. So I think like the research that you are involved with, and it's so important. It's so important because like as more and more people are using this and more people are looking for alternative ways to work on these issues, like having good data, having an understanding of how to effectively work with a substance like cannabis, I think is so important. So
I totally agree. I mean, I have mixed feelings about recreational use of cannabis. Basically, going back to what I had shared earlier, when there are issues that are not dealt with in one's life and cannabis feels good, it can actually exacerbate
the
those
underlying problem.
issues,
Yeah.
even though they might appear to be um, they may appear to feel good. I mean, I was married to someone who had cannabis use disorder, and they didn't know what that was called back then. Just that he used it all day long, every day, I couldn't have a conversation with him because there were two TVs in the bedroom, and cannabis took the place of it. So anyway, I
Yeah.
have mixed feelings about recreational use. I believe in medical use, absolutely. which is
Yes.
why I'm
So
petitioning the states to add FOD as a condition of treatment for medical
yes, yeah,
cannabis.
and again, so I would say there's probably very limited things you and I can do about recreational marijuana. It looks like it is here to stay. Certainly in the state of Maryland, I don't see
It's
that
coming to
going away.
Florida too. I mean, the governor,
Yeah,
I just saw some comments that he made about, it's cannabis because it's going to be voted on, and I think in November. It's been passed.
it's on the ballot.
It's on the ballot.
Yeah, so I think that was just as a side note here in Maryland, that was the measure that passed with the largest
Wow.
percentage. Yeah, I think it was close, somewhere between 70 and 80%
Wow.
voted in favor of legalization. I don't think there were many other political issues that saw such a lopsided vote. So
Well,
clearly,
ironically, alcohol is actually more dangerous than cannabis. I mean, when you look at the drug in terms of, I remember seeing a study about how the dangers of different types of drugs. The
mhm,
psilocybin mushrooms were like the least dangerous per se, but marijuana was actually less dangerous than
than
alcohol.
alcohol. Yes, yeah, which has been an argument that has been made for quite some time.
Yeah,
But all that being said, it is definitely here to stay,
it's
and I
here to
think
stay.
people getting access to this information is super important, and it's a topic that I think we're going to be diving into a lot more
That's
as these
wonderful.
questions come in about like, is it causing erectile dysfunction? Is it a treatment for erectile dysfunction?
Correct. And,
Right?
Dr. Jordan Tischler, he is my research partner. He's the VP of the Female Orgasm Research Institute of my nonprofit. And he was my dissertation advisor. He treats men and women who have sexual dysfunction. He's in Massachusetts. So he would be someone maybe to consider who has treated men with sexual dysfunction with cannabis.
Yep. So maybe we're going to have him on as well. Dr. Mulvehill, thank you very much for
Oh,
your time. This has been super informative. Really kind of giving me just like a whole new perspective on cannabis and its role in, again, in particular around this, again, what we call like the psychogenic side of the sexual function. In addition to its effects on the body. So it gives me a lot to think about, hopefully our listeners as well,
thank you.
as they journey towards their own, solutions, for erection and other sexual function
Thank you so much for
challenges. So
having me on, Mark.
yeah,
Thank you.
thank you for your time. I
Pleasure. Thank
appreciate
you.
that.